Cogito ergo sum. I think, therefore I am. When he inscribed those words mid-17th century into the history of Western philosophical thought, René Descartes was searching for the minimum foundation of all knowledge and concluded that this minimum was the reality of one's own mind. The phrase goes hand in hand with a modern shift towards what might be called a hypercognitive society. More than ever before, we define personal fulfillment in terms of rationality, productivity, and intellectual growth. I think, therefore I am. We let how well we think define how much we are worth. We construct identities based on the quality and coherence of our thoughts. It's not hard, then, to see why Alzheimer's disease inspires so much fear. Alzheimer's disease is a neurodegenerative disorder in which patients progressively lose their ability to form new memories and recall old ones. Patients might seek parents and relatives long deceased or be unable to sustain conversations with loved ones, looping the same questions over and over again. The brains of Alzheimer's patients show an accumulation of gunky plaques of a substance called amyloid. This protein is thought to cause the degradation and death of neurons in key memory pathways. However, that isn't to say that all kinds of memory loss are due to amyloid or are indicative of Alzheimer's disease. Some memory loss is associated with the course of age, perhaps due to the confluence of age-related complications such as high blood pressure, diabetes, and inflammation. However, this is problematic. If memory loss commonly occurs with aging, but Alzheimer's disease also manifests with increasing age, how can we tell apart the healthy from those who have Alzheimer's? How do we know who to send for medical attention before it's too late? Adults past the age of 60 can still expect to experience some trouble recalling the specifics of a particular time or place, especially in repeated daily situations. For example, you might forget where you parked your car in an expansive lot, or where you decided to leave your keys this time. However, there is an awareness that something has been forgotten, and with the help of a cue, people can finally recall what had been out of reach. The memory loss in severe dementia is different from these senior moments. Memory loss is not momentary and is at a more fundamental, disorienting level. It's the difference of not knowing how you left home to end up in this parking lot, or what those missing keys were even for. Admittedly, these differences are rarely textbook cases and can still be murky, especially in the early stages of Alzheimer's. If so, how can we diagnose Alzheimer's reliably and quickly enough in spite of this clinical ambiguity? Dr. Risa Sperling of Harvard Medical School has spent her career studying similar questions of aging and memory in the context of Alzheimer's disease.
What we do know is that some of what we used to call senior moments or age-associated memory loss, a fair bit of that, probably up to 30 or 40%, can be accounted for by people who actually have what we refer to as preclinical Alzheimer's disease. So it's quite challenging at cross-sectionally, meaning just doing a single memory test, to say this is the memory loss of Alzheimer's disease and this is the memory loss associated with normal aging. So first, I very much believe that we are diagnosing it or detecting it much too late. So we know that the changes in the brain have begun 10, probably 20 years before people get to the stage of dementia that we clearly recognize as Alzheimer's disease. And we now have methods to be able to detect the pathology, very similar to what we do in cancer, heart disease, diabetes, HIV/AIDS. We need to get to that point in Alzheimer's disease. Primary prevention is trying to prevent the pathology, the changes in the brain themselves. Secondary prevention, which is what we work on now, is taking people who already have the beginning of disease in their brain. We can detect the changes, but they don't yet have symptoms. And the secondary prevention is trying to prevent the progression towards the clinical syndrome. The secondary prevention is really important because we can use genetics and biomarkers where we can identify people right now with disease and try to prevent them from getting to the terrible stages of Alzheimer's disease.
It seems that memory loss is an unreliable marker for advances in diagnosis, treatment, and prevention of Alzheimer's disease. However, we must continue to distinguish the clinical face of Alzheimer's from that of normal aging to fight the idea that dementia is an inevitability and establish that it is another disease that can be overcome.